Look at him now. He looks fantastic.
Benjamin Peer is a happy little guy now.
Look at that smile.
But the road to get here wasn't easy.
We were just at dinner with my in-laws.
Mom Megan and her husband were visiting Colorado from Missouri when Megan, a doctor, realized that she was in preeclampsia.
And went to the closest ER, which happened to be the University of Colorado Hospital.
Benjamin came into the world at 29 weeks and spent a stressful 7 weeks in the NICU.
And he came home on October 6th.
A happy moment before the stress kicked back in.
A little after Thanksgiving, I started getting a lot of calls from CU Medicine saying that essentially that we had all these bills that weren't paid for by insurance.
Stress and confusion.
We added him to my plan within the first 30 days, and the coverage started from his day of delivery.
But now her insurance provider, United Healthcare, was telling her they weren't responsible.
That's when I found out about the birthday rule in Colorado.
The birthday rule for coordination of benefits in the first days of a child's life. Colorado's birthday rule says if a child's parents are on separate insurance plans, the parent with the earlier calendar year birthday is responsible for those first days. In this case, that's Megan's husband and his plan through Anthem. Megan's United Healthcare plan had initially paid the bills.
Around $400,000 for the hospital, and then about half that or a little over that, probably about $150,000 for physician care, was taken back by the insurance company. And we've been fighting ever since to get Anthem to pay.
Anthem paid the doctor bills eventually, but not the hospital bill. Megan was going back and forth with both Anthem and UC Health, which runs University Hospital. She contacted Steve on Your Side in early June, right after getting a letter from UC Health, oddly on Estes Park letterhead, saying that if she didn't get her insurance to figure this out, she might be responsible for the bill.
It's about $389,000, which is a huge amount of money, but I have not gotten the sense that anyone really wants to resolve it.
So we reached out to Anthem and to UC Health. UC Health told us there was never a balance on the family's bill, and it was up to the insurance to sort things out. Anthem said that they didn't have the right medical records from the hospital, but after we reached out, they suddenly got them, and we're in the process of sorting everything out.
I just want this to be over, and so we can move on with our lives.